This is a plain radiograph of the wrist region showing the following structures. We can see the lower end of the radius. This is the radius. We can see the lower end of the ulna. This is the ulna. So radius and ulna, they are meeting at a joint, the inferior radioulnar joint. In addition, we can make out the styloid process of the ulna and the styloid process of the radius. Then we can see the carpal bones. Next to the lower end of the radius, the carpal bone over here, boat-shaped bone, that is scaphoid. Then a moon-shaped bone, that is lunate, and a wedge-shaped bone, triquetrum, and this is pisiform, sitting on the triquetral bone. So scaphoid, lunate, triquetral, pisiform. Mnemonic from lateral to medial. She looks too pretty. This is trapezium, trapezoid, and the largest carpal bone, capitate, and this is hamate, and here we can see the hook of the hamate. So trapezium, trapezoid, capitate, hamate. From lateral to medial, the mnemonic is try to catch her. She looks too pretty. Try to catch her. From lateral to medial, that is a mnemonic. So I'll repeat one more time. This is scaphoid, S for scaphoid, L for lunate, triquetral, T for triquetral, P for pisiform. Proximal row of carpal bone, distal row trapezium, trapezoid, capitate, and hamate. So we saw the carpal bone in the wrist region. All are oriented in normal position. You can clearly make out the outline of the scaphoid. This moon shape overlapping. Lunate, this one, triquetral, sitting on that pisiform. Then there is trapezium overlapping with that trapezoid. Here is the capitate, largest carpal bone. Here is the hamate, and this one is the hook of the hamate. Also, we can make out the metacarpal bones. It's the base of the metacarpal, what I am drawing now. Starting from first metacarpal, second, third, fourth, and fifth metacarpal bone. Also, we can note at the head of the metacarpal, especially the first metacarpal, we can make out the sesamoid bones within flexor pollicis brevis muscle. We can also see the proximal phalanx of the thumb. That also we can see. So all this is normal. So what are the joints we can see? Definitely the inferior radioulnar joint, the radiocarpal joint or the wrist joint. Ulnar doesn't take part in the joint. We can see a clear gap over there. Ulnar does not take part in the wrist joint or the radiocarpal joint. Then we can see the intercarpal joints. Between the carpal bones there are joints here. They are called intercarpal joints. Then we can see Carpometacarpal joint. Clearly we can make out this is the Carpometacarpal joint. You can see the first Carpometacarpal joint is a separate cavity, whereas the remaining Carpometacarpal joint have a common cavity. This helps in the thumb for the purpose of opposition. All this we can make out from the radiograph. Also we can make out the Metacarpophalangeal joints between the head of the metacarpal and the base of the proximal phalanx. In the background we can make out this is a soft tissue shadow of the wrist region. Any soft tissue tumor are there, we should be able to make out this grayish white shadow, that is normal. If there is a tumor, there will definitely be a bulge over there in the soft tissue. If there is a fracture in the bone, there will be a break in the continuity of the bone, either here or in the carpal or in the metacarpal or lower end of radius and ulna. So any patient continuously having wrist pain or history of fall on the hand, we'll advise a plain radiograph of the wrist region. Thank you for watching and learning from Logic Medico. If you like this video, kindly press the like your first time, kindly subscribe to our channel. Thank you once again.